Today we talk about dementia. يعني لو نلاحظ الصورة اللي أمامنا، يعني هنا كأنه تمثل صورة الشخص أثناء الشباب، ولما الإنسان يمتد به العمر نلاحظ بين خلايا العصبية تبدي تضمحل. الصورة الأخرى تنطينا أيضا صورة معبرة. هنا لما الشخص يكون يونغ، هنا بنكون aging process. شوف هنا ضمور بعض الخلايا، لكن تلاحظ بالدمنشيا هنا في severe degenerations of the neuron. So dementia is defined as a progressive impairment of the cognitive functions occurring in clear consciousness. So very important, it occurs in clear consciousness, that is in the absence of delirium. Definition: dementia is an acquired global impairment of intellect, memory and personality, but without impairment of consciousness. يعني لو نلاحظ هاي المناطق، أهم منطقة الانفولفمنت مالها هي الهيبوكامبس، لأن هذا المكان هو مكان الميموري، وبعدين ينتقل للdegenerations of the neurons للcortex and other parts of the central nervous system. Dementia consists of variety of symptoms, suggest chronic and widespread dysfunctions. Global impairment of the intellect is essential feature manifested as difficult in the memory, attention, thinking, and comprehension. Other functions may be involved, like the mood, personality, judgments, and social behavior. Warning signs of dementia، يعني ما هي الأعراض اللي تحذرنا بوجود هذا المرض؟ Being unable to remember, asking the same question and repeating the same story over and over, becoming lost in the familiar places, being unable to follow directions. يعني شوف هنا يبقى يتيه مثل المكانات خاصة بالبيت، يعني مثل ما يندل مثل مكان التواليت أو أي مكان آخر بالبيت. Getting disoriented about time, people and place. ويبدي هنا بالتدريج أول مرة يفقد الorientation regarding the time, then the people and the place. Neglecting personal safety, hygiene and nutrition. The critical clinical point of dementia are the identification of the syndrome and the clinical workup of its cause. The disorder can be progressive, static, permanent or reversible. وهاي هي النقطة المهمة، لأن they notice that approximately 15% of people with dementia have reversible illness if treatment is initiated before irreversible damage take place. Regarding the epidemiology of dementia, they notice that the prevalence of dementia about 5% in the general population older than 65 years of age. 20 to 40%، شوفنا ايش قد ترتفع النسبة percent in the general population older than 85. فهنا يعطينا معنى بأن الage هو major risk factor بالنسبة للدمنشيا، and about 50% in those with chronic care facilities. About 60 to 70 to about from 50 to 60% of the demented patient, they are of Alzheimer type. The second most common type of dementia هي عندنا vascular dementia, and they notice that بالنسبة للhypertension يعتبر في risk factor, and about 15 to 30% of all dementia cases. Vascular dementia is the most common in the persons between the age of 60 and 70 years and is more common in men than the women. Approximately 10 to 15% of patients have coexisting vascular dementia with Alzheimer's. Also, other common cause of dementia, each representing about 1 to 5% of cases, like the head trauma, alcohol-related dementia, various movement disorder-related dementia such as the Huntington, chorea, and Parkinson's disease. This is the list of etiology. يعني نبدي مثلا neurodegenerative like الألزهايمر, Parkinson's, vascular, multi-infarct, neurological، نشوف هنا الهانتينغتونز and also نشوف هنا هاي الليست كلها من الكوزز اللي قد تكون هي المسببات للدمنشيا. risk factor also عندنا blood pressures, blood sugar, cholesterol, heart disease, diabetes, the vascular disease, head injury, inflammatory stresses, tumor, HIV virus, neurological disorder, depressions. وهنا depressions يؤدينا إلى what we call pseudo dementia، واللي إن شاء الله راح يعني نتكلم عن فروقاتها عن real dementia and so on. For all these مثلا هنا عندنا overweight, drug smoking, alcohol، كلها تعتبر فد risk factor بالنسبة للdementia. First of all, we discussed dementia of Alzheimer's at 1907. Louis Alzheimer فد عالم discover this type of dementia in patients, 51-year-old women with a history of 4.5-year course of progressive dementia. The final diagnosis of Alzheimer's disease requires a neuropathological examination. The etiology, first of all, the genetic factor play a very important role. They notice that, indicate that about 40% of patients have a family history of dementia of Alzheimer's type. Thus, the genetic factors are presumed to play a part in the development of the disorder, at least in some cases. Support of this, they notice that the monozygotic twin, which is higher than the rate of dizygotic twin, لاحظوها about 43% versus 8% in the dizygotic twin. In several well-documented cases, the disorder have been transmitted in families through an autosomal dominant gene, although such transmissions is rare. Alzheimer's type of dementia has shown to link to the chromosome 1, 14 and 21. ولذلك شافوا بأن الدمنشيا تظهر بنسبة جدا عالية ذول المرضى اللي عندهم داون syndrome. Neuropathological, very important. This is the classical and the pathognomonic microscopical finding اللي هي senile plaque, neurofibril tangles and neuronal loss. With that, there is a synaptic losses, perhaps as much as 50% in the cortex. Senile plaque, also referred to as amyloid plaque, more strongly indicated in the Alzheimer's disease, although they are also seen in the Down syndrome مثل ما قلنا, and also for some extent in a normal aging. The number and the density of the senile plaque present in a post-mortem brain have been correlated with the severity of the disease that affected the persons. لاحظ هنا normal brain، شوف هنا السلكاي narrow and الجايرس is well developed. لاحظ هنا هاي الصورة تنطينا demented brain. شوف هنا نلاحظ السلكاي widening and shrinkage of the gyruses. هنا بالنسبة pathological of the Alzheimer's disease، هنا normal cells لو نلاحظها neurons، لكن هنا نشوف بها موجودة الاميلويد tangle or senile plaque، while in the other slide we notice the neurofibril tangles، وكذلك نشوف السينايل plaque. بالنسبة للنيوروفايبرال تانجلز لو نلاحظ هاي المايكرو تيوبيولز اكو فد بروتين هنا الرابط بينه يسمونه التاو بروتين، هاي هنا بالنورمال سيلز، لكن نلاحظ هنا بالديمنتد نيورون شوف هنا يصير ديستراكشنز بالتاو بروتين ويصير عنده accumulation ويؤدي لنا النيوروفايبرال تانجلز. Neurotransmitters also, they blame that the acetylcholine and the norepinephrine, both of which they are hypothesized to be hypoactive. So both these neurotransmitters is decreased in the Alzheimer's disease. Several studies have reported data consist with the hypothesis that a specific degenerations of the cholinergic neuron is present in the nucleus basalis of Meninges، واللي هي هذا مكانها، هاي هي nucleus basalis of Meninges، وهاي الكولينرجيك نيورون متوزعة تقريبا على كل تقريبا أجزاء البرين. Also they blame that there is decrease in the choline acetyltransferase, and this is enzyme اللي هو responsible for the formation of the acetylcholine. لو نلاحظ هاي المعادلة نشوف الأسيتايل coenzymes plus the choline، هنا العمل مال الكولين acetyltransferase يطلع عندنا الacetylcholine. So in the Alzheimer's disease there is decrease in the acetylcholine and also the enzyme choline acetyltransferase. Also, they blame that decrease in the norepinephrine activity in the Alzheimer's disease. There is decrease in the norepinephrine containing a neuron in the locus ceruleus. لو نلاحظ مكان للنيوكليوس ceruleus تقريبا بالposterior part of the pons، وتبدي هنا شوف هنا تتوزع إلى بقية أجزاء البرين، تقريبا هاي كلها هي عبارة عن norepinephrine neurons. Also, there is two other neurotransmitters implicated in the pathophysiological conditions of the Alzheimer's disease are also inactive, like somatostatin and corticotrophin. Both of them decrease concentration of both these neurotransmitters in the Alzheimer's disease. Other causes, aluminum toxicity has also been hypothesized to be causative factors because a high level of the aluminum have been found in the brain of the patient with Alzheimer's disease. Also, excessive stimulation by the transmitters glutamate that may damage the neuron is another theory of causation. So there is elevations of the neurotransmitter glutamate، وهو يعتبر واحد من stimulant neurotransmitters، ولذلك نشوف إن شاء الله بالمحاضرات السابقة القادمة العفو راح نشوف اللاين اوف تريتمنت ينبني على أدوية اللي تحدد من الاكتيفيتي مال الجلوتاميت. And thank you.